Good morning, everyone. Today we are going to discuss about cosmetic surgeries. Cosmetic surgery is the type of plastic surgery that aims to improve the patient's appearance and enhances his or her aesthetic sense. It can be done for any part of the body. It may change the structure, the position, the color, or texture of a body part or feature. Some of the most common body parts which patients modify their cosmetic surgery, either changing the size or shape, include breast, ear, eyes, face, hair, nose, and abdomen. So we will see each one in detail. Cosmetic surgery is a specialized medical discipline focused on enhancing appearance, symmetry, and proportion through surgical and non-surgical techniques. Unlike reconstructive surgery, which repairs the structural defects or damages from trauma or disease, cosmetic procedures are elected to refine normal body structures and boost the self-esteem. So the goal of cosmetic surgery is to improve the appearance of an individual. It enhances the aesthetic appeal, proportion, and symmetry. This procedure can be performed throughout your head, neck, or body. So the types of cosmetic surgery include facial rejuvenation, eyelid lift, brow lift, neck lift, face lift, facial contouring procedures, rhinoplasty, cheek, chin enhancement, skin rejuvenation, Botox, fat grafting, peels, laser resurfacing, fillers, breast enhancement, breast reduction, breast lifting, breast augmentation, body contouring, tummy tuck, liposuction, gynecomastia, hair transplantation, hair loss treatment. So these are the different types of cosmetic surgeries: brow lift, neck lift, breast enhancement, breast reduction, tummy tuck, abdominoplasty, breast lift, chin augmentation or chin lift, rhinoplasty, eyelid lift, blepharoplasty, hair loss. So hair transplantation is done. These are some of the cosmetic surgeries. Common procedures: facial enhancements, rhinoplasty, nose reshaping, blepharoplasty is eyelid surgery, eyelids are lifted, rhytidectomy, that is facelift, otoplasty, ear pinning, body contouring, liposuction, abdominoplasty, and arm or thigh lifts. Then breast procedures, augmentation, reduction, mastopexy or breast lift surgeries, non-surgical treatments like Botox injections, dermal fillers, and laser skin resurfacing. So these are the surgeries: facial enhancement, cosmetic surgeries, surgical procedures, and minimally invasive non-surgical options. In facial enhancement, cosmetic surgeries are rhinoplasty, reshapes or resizes the nose for better balance or breathing. Facelift, that is rhytidectomy, lifts and tightens sagging skin and deep tissue on the face and the neck. Blepharoplasty is removes the loose skin and fat from upper or lower eyelids. Brow lift surgery smooths forehead lines and raises the drooping brows. Chin or cheek implants adds definition and volume to the jaw, chin, or cheekbones. Minimally invasive and non-surgical options are Botox injections, which relaxes the muscles to smooth the dynamic wrinkles and fine lines. Dermal fillers restores the volume to the lips, cheeks, and hollow areas. So here you can see the cosmetic surgery, before surgery and after surgery. The forehead wrinkles, here you can see the smooth forehead. Brow tosses, you can see the lifted eyebrows, you can see here. Under eye bags, here you can see the brighter under eyes. Nasolabial folds, here you can see before surgery. After surgery, reduce nasolabial folds. And here you can see sagging cheeks after surgery, lifted cheeks. Jaws are defined jaw lines. Here you can see the defined jaw lines. Rhinoplasty, first one, it's a nose job. It's a surgical procedure to change the shape, size, or proportions of the nose. It can enhance facial harmony, fix birth defects, repair injury damage, or improve the breathing difficulties. So there is open rhinoplasty and closed rhinoplasty and non-surgical, that is liquid rhinoplasty. Rhinoplasty is surgery to change the shape or fix the functions of the nose. It takes 1.5 to 3 hours under general or local anesthesia, where a surgeon makes cuts inside the nostrils or across the tissue between them, reshapes the bone and cartilage and closes the cuts. So surgical steps, anesthesia is given, incision is done, reshaping is done, and closure is done. Types are open and closed. In open involves an incision on the tissue between the nostrils, giving the surgeon a full view of the internal structures. Closed rhinoplasty involves cut veins only inside the nostrils, which leaves no visible scars on the outside. Non-surgical liquid rhinoplasty uses temporary dermal fillers to change the look of the nose without surgery. Functional rhinoplasty focuses specifically on fixing structural problems to help you breathe better. Open rhinoplasty is a nose surgery where a small external cut is made on the tissue strip between the nostrils. The surgeon lifts the skin to fully view and reshape the bone and cartilage, then closes. Open rhinoplasty gives the surgeon a clear, direct view of the bone. Complex structural changes, major reshaping and revision. Drawback: leaves a tiny, usually fading scar on the columella and can cause more initial swelling. Closed rhinoplasty, where a surgeon makes all cuts completely inside the nostrils. This technique leaves no visible scars on the outside of the nose, causes less swelling, and often that is the often better than the open procedure. Closed rhinoplasty, no visible cuts, best for minor changes, quick recovery, and shorter time is needed. Open versus closed rhinoplasty. The main difference is the incision placement. Closed method, cuts are hidden inside, best for simple changes, heals fast. Open method uses an extra cut across the skin between the nostrils, best for major or complex work. So techniques in rhinoplasty, that is in the external rhinoplasty, that is known as closed rhinoplasty, and endonasal rhinoplasty is the open rhinoplasty. Liquid rhinoplasty is a fast non-surgical treatment that uses gel injections to change the shape of your nose. Doctors use it to smooth out small bumps, lift a droopy tip, or fix uneven spots. The process: a doctor puts numbing cream on your nose and injects a filler gel under your skin. Most doctors use hyaluronic acid gels like Juvederm or Restylane. So you see a change right away, and you can go back to your day with little or no rest time. The new shape stays for about 6 to 12 months. So non-surgical approach is liquid rhinoplasty. It's an injection of dermal fillers into the nose to alter its shape. This is functional rhinoplasty. You can see before, 1 week after, and one bed after. So functional rhinoplasty is a surgical procedure designed to repair internal structural problems to the nose to improve breathing and airflow. Unlike cosmetic nose jobs that focus only on appearance, it fixes issues like crooked septum, weak nasal walls, or blocked passages. So common problems which are deviated septum, nasal valve collapse, enlarged turbinates, and nasal trauma. So in deviated septum, a crooked center wall inside the nose that blocks one or both sides. So nasal wall collapse, weak cartilage that causes the nose to narrow or squeeze shut when you breathe in. Enlarged turbinates, swollen or oversized tissue turbinates inside the nose that restrict air movement. Nasal trauma, prior breaks or injuries from the accidents. So functional rhinoplasty is a surgical procedure designed to repair internal structural problems in the nose to improve the breathing and airflow. Indications: history of nasal trauma, history of cancer reconstruction, congenital deformities like deviated septum and other abnormalities which predispose poor nasal function, and age-related changes as it loses its structural integrity as the nose ages, especially in the nasal tip. So these are the indications for functional rhinoplasty. Internal functional nose surgeries procedures, what is done is septoplasty, inferior turbinate reduction, polypectomy, and sinus surgery. External nasal valve repair, internal valve repair, nasal bone strengthening. These are all the procedures done during the functional nose rhinoplasty. Possible risks are there: unfavorable cosmetic outcomes, pain, bleeding, infection, persistent nasal breathing difficulty. This is blepharoplasty, eyelid surgery. Excess skin removed from the eyelids, reduced bagginess. You can see before and after the surgery pictures. Blepharoplasty is a surgical procedure to repair drooping eyelids. It involves removing or moving extra skin, muscle, and fat from the upper or lower eyelids. Types are upper eyelid surgery and lower eyelid. Upper eyelid cuts are made in the natural fold to remove extra skin and fat that causes a heavy or hooded look. Lower eyelid cuts are made just below the lashes or inside the eyelid to fix the puffiness and under eye bags. So, rhytidectomy, commonly known as a facelift surgery, is a surgical procedure designed to address loose skin, excess fat, and muscle laxity that develops with age. As we mature, our skin naturally loses the elasticity, and underlying facial muscles began to sag, creating jowls, deep wrinkles, and a tired appearance that may not reflect how vibrant you feel inside. So here you can see rhytidectomy is done. That is facelift surgery. Rhytidectomy is a surgical procedure that improves visible signs of aging in the face and neck. It works by tightening underlying muscles, removing or redistributing fat, and trimming excess skin to create firmer, more youthful counter. So incisions are made inside near the temples, hidden in the hairline, around the ears, and sometimes under the chin. Tissue adjustment is done. The deep facial muscle and tissue layer is lifted and repositioned. Skin draping is done. Excess fat and skin are removed before closing the cuts with fine stitches. Facelift techniques: smash, facelift, deep, plain, mini, and neck lift. These are for facelift techniques. Smash imbrication tightens and folds the superficial musculo-aponeurotic system, muscle layers with sutures, with or without trimming the tissue to support the lower face. Deep plane facelift releases retaining ligaments beneath the smash layer, that is the superficial musculo-aponeurotic system. The skin and muscle move as a single unit for a natural, long-lasting look. High smash facelift elevates the smash layer, that is the superficial musculo-aponeurotic system layer, high up virtually to strongly lift the midface and jawline. Mini facelift uses shorter incisions and targets mild to moderate jowling with a quicker recovery. Endoscopic or ponytail lift employs tiny hidden incisions to lift upper and mid-face tissues vertically. Non-surgical options are liquid facelift using dermal fillers and neuromodulators to restore the volume and smooth lines. Thread lift inserts temporary dissolvable threads to mechanically pull and support the skin tissue. Liquid facelift, dermal fillers are used like hyaluronic acid or biostimulators. Neuromodulators procedure take usually 20 to 45 minutes in an office setting with minimal downtime. So liquid facelift, elevate the eyebrows, erase the worry lines, restore the volumes, and tightens the neck, softens the frown lines, and minimize the crow's feet. Lift the corners of the mouth. These are the possibilities of liquid facelift possibilities. So thread lift is a great way to reshape and restore the firm contour of your face. It is used to improve areas like brows, cheeks, or neck. Non-surgical treatment in which fine threads are inserted into targeted areas under the skin to stimulate the collagen, which produces a tightening effect from inside out. When sagging skin is tightened, it creates a more sculpted V-shaped face as well as brighter, firmer skin. Otoplasty or ear surgery. So it reshapes, moves or makes the external ear smaller or larger. It fixes sticking out ears or birth defects, usually by working on the cartilage behind the ear. 1 to 3 hour outpatient surgery leaves hidden scars and needs weeks of healing with head bandages. Goals are pinning back ears that stick out too far from the head, reducing the size of the large ears, rebuilding or fixing the ears hurt by injury or birth issues. So here you can see the microtia or a class 4 microtia or anotia representing the complete absence of the, in class 4 you can see the complete absence of the external ear. So microtia means small ear. So it may resemble other severe congenital ear anomalies such as extreme grade 3 microtia, with only a small peanut shaped remnant tissue. Could be associated with developmental variations of first and second brachial arches affecting craniofacial structures. So autoplasty is done for this microtia. Prominent ear you can see, and here you can see repaired ear. Autoplasty, first anesthesia is given, local with numbing medicine or general anesthesia. Then a small cut made behind the ear fold, fixed cartilage is bent, trimmed or held with stitches, and stitches are closed. Stitches closes the body countering cosmetic surgeries are tummy tuck or abdominoplasty, removes the loose skin and tightens the muscles. That is also known as tummy tuck. Tummy tuck is used to make the abdomen thinner and more foamy. It helps to remove the excess skin and fat from the middle and lower abdomen in order to tighten the muscles. Liposuction sucks out targeted pockets of unwanted fat. Then lower body lift fixes sagging skin on the abdomen, hips, buttocks and outer thighs. Arm lift, that is brachioplasty. An arm lift is a cosmetic surgical procedure to improve the appearance of the under portion of the upper arms. It is used to reshape a person's arm to meet the aesthetic goals for their body. Liposuction may be included in the procedure. Then thigh lift reshapes the inner or outer thighs by removing loose skin and fat. So liposuction is a surgical procedure. Here you can see liposuction. That's a surgical procedure that uses suction to remove the stubborn fat deposits from specific areas of the body. This involves the removal of fat from the body through small cuts in the skin using suction techniques. Normally, liposuction is done for cosmetic purpose, but sometimes it is used to certain conditions also, lymphedema, gynecomastia, lipodystrophy syndrome also. So it's a surgical procedure that uses suction to remove the stubborn fat deposits from specific areas of the body like abdomen, thigh or neck to improve the body shape and proportion. It is a body countering method, not a general weight loss suction. So liposuction techniques, tumescent liposuction, the most common method is a very large amount of medicated fluid is injected into the fat to reduce pain and bleeding. Ultrasound assisted liposuction uses sound waves to liquefy the fat cells before removal. Laser assisted uses laser energy to melt the fat for easier extraction. Power assisted uses a motorized vibrating tube to break up the fat. So body countering, you can see targets arm area, blepharoplasty. Blepharoplasty, we are removing the arm lift or brachioplasty. Okay, arm lift or brachioplasty, that is the target arm area, is used to reshape a person's arm to meet the aesthetic goals for their body. Liposuction may be included in the procedure. So it tightens liposuction for tightening and firms the body. Abdominoplasty targets the stomach's area, eliminates the cellulite also. Sometimes we are doing buttocks also we are removing. Targets the thighs and buttocks area. Also we are removing. Liposuction is abdominal plasty is known as tummy tuck. It is a surgical cosmetic procedure that removes excess thin and fat from the abdomen by tightening the underlying connective tissue and muscles to create a firmer, smoother profile. So removal of excess fat. Here you can see the removal of excess fat and skin and tightens the muscles in the abdominal walls. So mini abdominoplasty is full abdominoplasty and extended or abdominoplasty. Full abdominoplasty addresses the entire midsections involving a hip-to-hip incision, tightening the abdominal muscles and repositioning the belly button. Mini abdominoplasty involves a shorter incision placed lower down and does not reposition the belly button, best for minor skin laxity below the navel. Extended used for patients with significant vertical and horizontal excess skin, often following massive weight loss. These are the tummy tucks scars. You can see full abdominoplasty, mini extended. So here is pre-operative procedure, consultation, planning and instruction. During the operation, anesthesia is given, muscle repair and incision and closing. So recovery period, post-operative recovery period, home care is there, follow-up also. Breast cosmetic surgeries are breast augmentation, adding size with implants or fat, breast reduction, removing extra tissue, and breast lift. Fixing saggy skin. Breast augmentation or enlargement traditionally performed using saline or silicone gel prosthetic. So breast augmentation, here you can see the implants. Before surgery, subglandular implant is kept. Here subpectoral implant is kept under the breast. So main type silicone implants, saline implants, fat transfer placement options. So silicone implants filled with cohesive gel for a natural look and feel. Saline implants filled with sterile salt water during surgery, adjustable. Fat transfer uses liposuction to move fat from another body part to the breast for a subtle size increase. Placement options placed either under the breast gland, subglandular or beneath the chest muscle, submuscular or dual plane. Main types of surgeries are breast augmentation surgeries, breast implants is there, breast reduction is there, breast lift or mastopexy is there, and reconstruction surgeries. Augmentation uses silicone gel, saltwater implants or fat transfer to make the breast bigger. Reduction surgery takes away heavy fat and skin to stop back and neck pain. Lift, that is breast lift surgery, mastopexy, tightens the skin and moves the nipple higher for a firmer shape. Reconstruction rebuilds the breast shape after cancer treatment. So breast reduction surgery is reduction mammoplasty. Removes extra fat, tissue and skin from the breast to relieve physical pain like back and neck aches, skin irritation and posture issues. The procedure takes 2 or 4 hours under general anesthesia and recovery typically takes 2 to 3 weeks. Breast lift mastopexy is a surgical procedure to raise and reshape the sagging breast. The surgeon removes extra skin, tightens the tissue and moves the nipple higher. It restores a firmer, younger look, but it does not change your breast size. In breast mastopexy surgery, it's to raise and reshape the sagging breast. The surgeon removes the extra skin, tightens the tissue and moves the nipple higher. Restores a firmer, younger look, but it does not change your breast size. Breast reconstruction rebuilds the shape of a breast after a mastectomy or lumpectomy. It uses either medical implants or your own body tissue to restore the form and symmetry and confidence. Non-surgical cosmetic surgeries are treatments are Botox injections, dermal fillers, and laser skin resurfacing. So laser skin resurfacing, ablative lasers like vaporize outer skin layers like carbon dioxide or erbium for deep wrinkles and scars but need longer recovery. Non-ablative lasers heat the underlying skin without removing the top layer, offering a short recovery time with milder results. Non-surgical cosmetic surgeries are non-surgical cosmetic procedures included in cosmetics procedures are Botox injection, non-surgical treatments, Botox injection and dermal fillers. Non-surgical treatments, Botox injection uses purified botulinum toxin type A to temporarily block nervous signals and relax specific muscles or block sweat glands. It takes 10 to 15 minutes, provides results within 3 to 7 days and lasts for 3 to 4 months. Dermal fillers, gel-like medical substance injected beneath the skin to restore the lost volume, smooth lines, enhance facial contours, and plumps the lips. Results typically last from 6 months to 2 years depending on the material used in the treatment and the treatment. Common types of fillers, dermal fillers are hyaluronic acid, HA, a natural skin gel like Duoderm that adds moisture and volume, lasts 6 to 18 months. Calcium hydroxyapatite, that is a heavier mineral-like compound like radix, used for deep lines and contouring. Then poly-L-lactic acid, a synthetic material that builds your own collagen over time. Dermal fillers under the eyes. Dermal filler treatment is a non-surgical procedure that uses filler injections to plump up fine lines and wrinkles and boost the volume in your face. Dermal fillers help enhance the overall facial features and look youthful. Under eye fillers or tear trough fillers are specifically used to plump and brighten the eye contour. Dermatologists inject these fillers directly near the site to reduce the hollowness. Hair transplantation is a minor surgery that moves healthy hair follicles from a donor site, usually the back or sides of the head, to thinning or bald areas. It treats genetic hair loss and the transplanted hair grows naturally over time. Main techniques are follicular unit extraction, removes individual hair follicles directly using a small punch tool, leaves tiny unnoticeable dots. Follicular unit transplantation, FUT, removes a thin strip of scalp tissue from the back of the head to harvest the follicles, leaves a linear scar. So here you can see the hair transplantation before and after. So conclusion, cosmetic surgery is a unique branch of medicine focused on improving the body parts and looks. It is different from reconstructive surgery, which repairs the body from after harm or illness. People choose cosmetic treatments to change their shape, look younger, or feel more sure of themselves. So these many types of cosmetic surgeries are liposuction, abdominoplasty or tummy tuck, arm lift or brachioplasty, breast augmentation surgeries, buttock augmentation or gluteal augmentation, chin augmentation or chin lift, reduction mammoplasty or breast reduction, female genital aesthetic surgeries are there like labial reduction, vaginal tightening and hymen repair. Male genetic aesthetic surgeries are there, that is penile enhancement. It involves increasing the girth of the penis by fat or dermal grafting. The procedure is requested for various reasons including increasing sexual satisfaction. Penile lengthening is also carried out by suspensory ligament release and few other techniques. So there is male genital aesthetic surgeries. Then blepharoplasty or eye lift surgery, brow lift forehead or forehead rejuvenation, a facelift or rhytidectomy, liposculpture, that is an operation performed to eliminate a fat deposit located between the skin and muscle. So that is a liposculpture. Rhinoplasty, that is a nose reshaping. Ear surgery or otoplasty, defect in the ear structure that is present at birth that becomes apparent with development, can be corrected by otoplasty. It helps in treating microtia, anosia, etc. Then peels, fillers, grafts and laser treatment. Chemical peels may help to treat acne, pock marks, scars or wrinkles. Botulinum toxin or Botox to improve the appearance by treating wrinkles and facial creases. Dermal fillers, they are injected into the skin and reduce the appearance of wrinkles. Lasers and light-based facial treatment, fat grafting procedure or fat injection transfers the fat from areas in which you have excess fat, such as outer thighs, and injects into the area that may be lacking in volume, such as your face, hands, breast or buttocks. Then hair transplantation, surgery can return hair growth to those who have hair loss. These are the different types of cosmetics surgeries. Thank you so much.